The Arthrokinematic restoration system for the temporomandibular joint. So the temporomandibular joint is going to be between the temporal bone and the mandible. And when we open our mouth, the mandible is going to glide anterior. So we need that anterior movement. And that is usually uncomfortable for folks to chew, to open or close their mouth when they have temporomandibular problems. So with gravity, when the head goes forward, what happens too is that temporal bone can go forward. That's going to be a concave on a convex surface, so it's rolling, gliding forward. And then that mandible is in that posterior position. Same thing with clenching. If I'm clenching, my mandible is going to be in a posterior position. So we're going to restore the anterior glide in the temporomandibular joint. So we're going to release the muscles that are preventing the anterior glide, and then we're going to stretch those muscles and then strengthen the muscles that are going to help open the mouth, and we'll do that isometrically. I like to do this lying down so that gravity can help us and allow the temporal bone to not shift forward and the mandible to relatively shift backwards. So we want to restore that anterior glide. First, we're going to release the temporalis, and then the masseter, and then the medial pterygoid. And let's do this on our back. So you can do this sitting up. Either way is going to work just fine, but this does better position that joint. So with the temporalis muscle, it's going to be that fan-shaped muscle that's going to be just behind the eyes, right across on top of the temporal bone. And what you want to do is you want to first take your fingers and you're going to just spread or go perpendicular with the muscle. And then you can go parallel. You can get some gentle movements to find any tension in that temporalis. This is also responsible for headaches in folks too. So you just want to mobilize, find trigger points. If you feel like you've got a lot of tension or tenderness, hold for about 20 seconds. And you want to move slowly. It takes 2 minutes for the fascia to release. So I will spend 2 minutes on each muscle group depending on the need and what you're feeling too. So you want to search for any of that tension and see if you can hold prolonged pressure to get that tension to release. So that's the temporalis. Then I'm going to come down onto my masseter. So the masseter is going to go from that zygomatic arch down to the ramus of the mandible. And so I am going to go in and gently, so sometimes with temporomandibular joint dysfunction, this is really tender. So you want to be gentle, find any of the tension in that muscle. And I go parallel with the muscles. So I'm going to go up and down slowly. And then when I find tension, I'm going to then go forward and backwards, so an anterior posterior movement. And I am just gently mobilizing both the fascia and the muscle. And when there's an area of tenderness, I'm just going to hold. Then I'm going to take my thumbs and I'm coming up right underneath the ramus of the mandible and right behind. This can be really tender in this area. This is going to be part of the medial pterygoid. All of these muscles are going to help to elevate and close the mouth. And I'm going to spend time here. After I have released the temporalis, the masseter, and the medial pterygoid, I'm going to stretch them. Now I will use a glove and go in and stretch the inside. Some folks may not want to put their fingers in their mouth. You can self-release on the inside, and it usually feels really good to go and release the inside. If you do that, you're just going to go into the mouth, and you're going to find that you'll run into some bone or some hard tissue. And you want to go, it's like a pocket on the inside of the mouth, and you'll go into that pocket, and then you're going to press inward gently. And you just hold prolonged pressure on that area. After I've released, I'm going to stretch them. To stretch, I'm going to open my mouth. Remember, this is uncomfortable with someone with temporomandibular joint dysfunction. So what I will do is grab the mandible and gently bring it forward as the mouth opens to assist that anterior glide. You want to hold this stretch and hold it for a minute. You can do it 3 times. Unless it becomes uncomfortable, then you can come out of that. So those are the 3 muscles to stretch and and we've already released them. Then the next thing is going to strengthen the infrahyoid digastric muscle, and that's going to be the depressors that open up the mouth. So what I'm going to do is use my fist, place them gently underneath my mandible, and I'm going to try to open my mouth and use isometric contraction, hold for 10 counts. I'm going to do this 6 times. So I just open my mouth, pushing against my fist. And relax, and pressing again. Relax, pressing again. Relax, I'll do 3 more. And that is going to be the strengthening portion of the arthrokinematic restoration for the temporomandibular joint. You can do all of these sitting up. It's not necessary to lie down. I like to go ahead and eliminate gravity and work on those areas. That it completes the arthrokinematic restoration for the temporomandibular joint.